Lower limbs, let's start with the pelvis, how the lower limbs, the femur is attached to the pelvis, to the body. The femur's head fits right into the acetabulum, that is lateral to the on the pelvic bones. The pelvis is made up of three bones, two pelvis bones, the coxal bones, and one sacrum bone. The pelvis bone is fused together by three bones. One of them is the ilium, the upper part. This is the ilium, the upper third of the acetabulum, and the superior part. The anterior part is the pubic bone, and the inferior part is the ischium bone. On here, the landmarks, what we have to distinguish, actually, we have to distinguish the false pelvis area up till to the brim of the pelvis, and inferior to the brim is the true pelvis area that is constrained. The superior part from the brim is not that constrained. On the crest, on the superior surface is the iliac crest. The iliac crest contains the anterior superior iliac spine as well as the anterior inferior iliac spine. On the back, we distinguish the posterior superior iliac spines and the posterior inferior iliac spines. From the side, you can see the greater iliac, greater sciatic notch. That inferiorly, you see the ischial spine on both sides. Inferior on the ischial bone is the ischial tuberosity because it's really rough surface. This is when somebody sits on your lap, this is what you feel. On the sides, we talked about the acetabulum, but this window or big round openings are called the obturator foramen on both sides, where nerves are leaving the pelvic area. So this is the now the pelvis is off. Here is the femur. The femur contains the head, and the head is attached to the shaft through the neck. We distinguish on the lateral anterior part, more like lateral, is the greater trochanter, and posterior to the bone is the lesser trochanter. The greater and the lesser trochanter is connected by the intertrochanteric line anteriorly, and on posteriorly is the intertrochanteric crest because it's more prominent. As we go on the posterior surface, we see a rough surface in here. So this rough surface is the gluteal tuberosity. Going distal on the bone, we have the distal epiphysis. On the distal epiphysis, we distinguish between the medial condyle and the lateral condyle. This is the anterior surface, so this is the medial. How do I know? Because the head is on medial condyle and lateral condyle. Above the medial and lateral condyles, we have the medial epicondyle and the lateral epicondyle. This smooth surface is the patellar surface, where the patella sits. And on the posterior surface, we have a notch in here, and this depression is the intercondyle fossa depression. Now to the femur, we have the bone. I don't think it's the right bone actually in here that sits in here. No, this is not pairing up with that. Okay, so this is the tibia. On the proximal end of the bone, here at the proximal epiphysis, we have the lateral and medial condyles. How do we know which one is medial and lateral? We have the medial sticking lower malleolus. So this is the medial malleolus on the medial surface. So it's going to be the medial condyle here. And this is the lateral condyle, how they fit together with the femur. Between the condyles, we have the intercondylar eminence sticking out. These are the two intercondyle, between the condylar eminence sticking out part. In the anterior surface, we have the tibial tuberosity. We have the anterior border, and on the lateral, on the medial side, we have the medial malleolus. Next to the bone is going to be the fibula. How do we know which one is the proximal and the distal and epiphysis of the fibula? Well, one of them is really pointing out more than the other. This is more blunt. Both of them are sticking out, but this one sticks out more. So this is going to be the distal end, and this is the head of the fibula, and this is the lateral malleolus of the fibula. And last but not least, this is going to be the study of the thoracic cage, and as well as the sternum. The sternum is here. It has three parts. The manubrium. Manubrium is the handle like of a sword. If I would just hold this like a sword, it looks like kind of a sword. So this top part is the manubrium. This bigger part is the body of the sternum. Between the manubrium and the body, we have the sternal angle, a little bit of angling down. And the bottom part is the xiphoid process. Here we have the ribs. We have 1, 2, 3, 4, 5, 6, 7 true ribs up till here. And the 3 other ribs are called the false ribs because they do not attach themselves separately to the sternum, but they join the, what is that, the hyaloid, not that one, what is that, the cartilage joins with the 7th ribs cartilage. And also you cannot see in here, but the 2 other ones are the false, the floating ribs that you cannot see on here. These parts, actually these 2 parts, where the clavicle binds to, and we call them clavicular notches. And this is the jugular notch, and this is not as important. Okay, so that's it.